Thank you so much for your patience. As my host was just saying, he apologizes for this, and so do I. But I am so happy to see so many of you on today, and welcome to Full Circle's Pregnancy Orientation webinar. I am your host, Dr. Adams. Some of you just met with a little bit earlier today for your history visits, and some of you I still have coming up later this week. So we're going to go ahead and jump right in since I am a couple of minutes late, and I again do apologize for that because that is not the Full Circle way. First, some housekeeping items. This is confidential. So if everyone can hear me, you can raise your hands, and I should see some hands going up right now. And no one can tell whose hands are going up except for me. So feel free to ask any questions that you have in real time, and I will pause and I will answer them then. Please participate. I have some poll questions out there to make sure that you are catching everything that I'm putting out and that you're still awake. And then finally, as long as you registered for this, I understand if you need to jump off, it's dinner time or what have you. You should receive a link later on from Zoom so that you can watch this later on our YouTube. This presentation will be available for the duration of the majority of your pregnancies. So we're going to start out with a poll question right now to just show you how it goes. Who's on the line? How many first-time moms do I have, and how many mommy veterans do I have out there? So some of you heard me use the term mommy veterans earlier, and this is a nice example of how I do things. I talk a little bit, and then I say polls are closed. All right, so mommy veterans are okay, slightly outweighing the first-time moms this time. So this is a nice refresher for those of you who have been through a pregnancy before, whether it was with Full Circle or someplace else. Nice refresher because pregnancy is kind of a blur. You're like, I know I did something, but I can't remember what week I did it. And this will just kind of remind you of where everything goes. And first-time moms, I know you have a whole laundry list of questions that you were planning to bring in and ask, and I'm going to answer most of them before you even get a chance to ask. All right, so things we're going to cover today will include the full circle experience, which includes where we deliver, some office protocols. We'll talk about what to expect at your pregnancy visits. I'll give you some prenatal resources. We'll go through exercise and nutrition in pregnancy, and finally have a little COVID-19 update as well. All right, so first of all, the basic philosophy at Full Circle is rooted in the collaborative midwifery model, which is based on the fact that pregnancy and birth are normal life processes. Normal. So, whoops, we already have a question out here. So I'm going to come back to that in just a moment because I actually do answer this question about the brand of vitamin B6 and the maximum dose to take in a day. Thank you for that question. I am going to get to that later on, so please stay tuned. Normal life processes. In the traditional midwifery model, we care for women who are low risk, but if they identify an issue with the pregnancy, then they may have to transfer out to see a physician to a different level of care. In the collaborative model, however, you're able to stay under the care of the midwife with physician direction. So if midwives are doing your fundal height, they're checking your blood pressure, making sure baby's okay, reviewing your ultrasounds. If there's anything abnormal about your ultrasounds, it goes through myself, Dr. Marrow, Dr. Mooney, and we provide direction for the midwives on anything that is not a physiologic part of pregnancy. To that end, the majority of the vaginal deliveries, even if they're vaginal deliveries after cesarean, are attended by our certified nurse midwives. Now, there are some things in labor and delivery that are outside the scope of a nurse midwife, and in those cases, physician consults are immediately available. Depends on if it's urgent versus emergent. If it's something urgent, like, oh, your baby's not behaving, like needs to come out, but decides doesn't want to come out, just stuck. They call one of us, and one of us is always backing up our own midwives. And if it's something emergent, meaning it can't wait the 15 or 20 minutes it takes one of us to get to the hospital, baby needs to come out right now. Our hospital has OB hospitalists, board certified OBGYNs who are in-house 24 hours a day. They can get a baby out in 5 minutes if that's what you need. To put in perspective, we did over 500 deliveries, almost 550 deliveries last year. We only had to use the hospitalist for emergencies 2 times. And even in those times, we were usually there by the time the baby was being born physically. Our primary hospital of delivery is HCA Florida Memorial Hospital. That is where we deliver. If you would like to be admitted and be taken care of by us, this is where you'll need to go. On University Boulevard, it's not far from our office. They are doing tours of the facility. There's a phone number available at the office. When you come in for your visit, just let the midwife know you want to do a tour, and she will get you the phone number of the Director of Women's Services, and she will do a one-on-one tour with you. She'll arrange it after hours, on weekends, whatever is most convenient for you, to show you the facility so you know where you're going to meet your new little one or little ones. And also just kind of give you an idea of what it's going to be like when you're in the facility. They offer lots of classes for new moms, childbirth education classes, which they have comprehensive. It's a 5 week or condensed weekend course. Goes through labor, what it's like being admitted on labor and delivery, and some newborn care topics as well. They have breastfeeding courses like positioning, making sure your baby's getting enough milk, pumping, going back to work, and then sibling classes, which are so sweet to help to prepare big brothers, big sisters from ages 3 to 7 for the new baby, because it's a big change for you, but it's also a big change for them, which is super sweet. So those classes are available. Our hours of operation are Monday through Thursday from 9 to 1. Then we close for lunch from 1 to 2. And then we reopen at 2, and then we stay open until 5 o'clock. So and sometimes I'm here until 5:35, which is why I was late for today. Sorry about that. But during 1 to 2, the phone does roll over to our after hours voicemail. So if you call between 1 and 2, you'll get the after hours voicemail. The reason it's set up like that is that if you have a true emergency, the person who is on call has the after hours line. And if you have an emergency, you can still reach somebody. If it is not an emergency, if it's something administrative, like, oh, I have an appointment at 3, but I need to, push it back or cancel or reschedule, please don't leave that during the lunch break. It will give you all of these prompts. But if you need to speak to somebody urgently, you can still reach them then. On Friday, we're open from 9 to 1. So if you're calling with a non-urgent matter at 12:53 on a Friday afternoon, please know you may get an answer on Monday morning, assuming it's not a holiday. But those are our hours of operation. In terms of appointments, we don't have walk-in appointments. Our goal is to see you as close as possible to your appointment time. We cannot do that. If we promised you the 3 o'clock spot and somebody else decides to walk in 2:58 and we give her your 3 o'clock spot, that's not respectful to you or your scheduled time. And so we try to give you appointment times and stick to them to respect your schedule. To that end, we have limited number of same day appointments, but if you call, say at 9 o'clock in the morning, hey, I've got a problem, I really need to be seen, and we're saying, hey, Jane has a spot on her schedule at 3 p.m., then that's the next spot that we have. If you have something that is more urgent, like it's 9 o'clock, we really shouldn't wait 6 hours to address this, we may suggest that you go to the hospital to be seen or that you go to an urgent care. It is not us saying that we don't want to see you or saying your problem is not important. It's us agreeing with you. Your problem is important, and it probably should not wait and sit in our lobby for 6 hours waiting for us to be able to put you in on our prearranged schedule. The next question I have up here is there a direct line for emergencies? That's actually coming up too. It's like you're a mind reader. Have you seen this presentation before? When you call the office, providers are not able to leave patient appointments to take phone calls. You schedule an appointment with us, and so we set aside that time to talk to you. If I leave your appointment, that's saying that I feel the other person's problem is more urgent than yours, or more important than yours. And that is not the case. And so when you call, please show the same respect for your fellow patients who scheduled appointments and waited to speak with us. There is always someone who's on call for the practice. We have a triage nurse as well. So Tony is taking messages. She has a scope of questions that she's able to answer without consulting one of us. But if it's something that's outside of that scope, she knows how to reach the provider on call to get a faster answer for you. When you do call, you have to leave a message in order to receive a call back. Be sure you're leaving the message with the proper person so that you get an answer in a timely fashion. So who do I leave the message with? Excellent question. If you have administrative issues or nurse questions, Tony, as I just mentioned, she's the nurse who does our triage phone calls. She also is in charge of letters and forms like FMLA and disability forms. Our OB clinical coordinator, Naisha, many of you have already had contact with her because she's the one who sends out your blood work. She also sends out referrals. Say you need to see the high risk doctor, or you need to be sent to cardiology or something along those lines, hematology, or at the end of pregnancy, if you need something scheduled like your induction or your C-section or your tubal, Naisha is the one who takes care of that. Everyone on this call, I believe, has already spoken with Renee Hall, who's our benefits coordinator. So if something happens with your insurance, many of you are having insurance changes coming up in January. Please, please, please be sure that you update your insurance and speak to Renee or someone in the benefits department. Because if your benefits are changing, we might be collecting on a prepayment plan we no longer need to, or we may need to make other arrangements because now the insurance is changed and something new is due that wasn't due on the old plan. After hours, see, here's the answer to your question. You can reach the emergency on-call provider. So this is for use if you think you need to go to the hospital. This isn't, oh, I had a visit today and I forgot everything she said. Let me just call and have them read my chart back to me. Because remember, this is also the person who is at the hospital physically catching babies, taking care of people who are admitted with blood pressure concerns and all of these other urgent matters. So you're calling her if you think you need to join that crew of people that she's taking care of. You have to leave a voicemail message to receive a call back. It is the same phone number that you call for the regular line all the time. After hours, it just goes to our after hours line. Just follow the prompts and it'll tell you how to reach the emergency on-call provider, and be sure you leave a voicemail according to the instructions that are on the phone, on the outgoing message there. Other ways to contact us include the patient portal. This is not for emergencies because response times can take up to 2 business days. We do not conduct business in the office on Saturdays and Sundays. So these are office business days. So if you send a message on a Thursday, you may not get a response until Monday. So keep that in mind when you're sending a patient portal message, that we do have 2 business days to respond to it. If it's something that doesn't require an action from us, it's just a question, hey, can I drink this tea or something along those lines? Especially if you have an appointment coming up in the next couple of days. Like if I see you're asking me a question on a Monday and you have an appointment on a Wednesday, instead of using those 2 business days, I'll just send it to the person who's going to see you on Wednesday and she can answer it at your next appointment. And then, so good use of the portal is something like, I lost my lab slip. So you left, you have 4 weeks before your next visit. You're supposed to get this blood work done, but you can't find your lab slip and you don't really trust Quest to have the electronic order. Just send a message and we can have our OB coordinator email you a new lab slip. That's a good use of the portal because you have 2 business days before you need that. Or if you have COVID and you need to cancel your appointment, but your appointment is not in 2 business days, it's farther out, send that to us and we can make sure that the front desk gets that and we can get you rescheduled. What we would typically do is just set your appointment you already have scheduled to be virtual so we can still check in and talk through your symptoms, make sure you don't require additional support. But these are good uses of the patient portal. Things that we don't want to see on the patient portal: urgent matters such as blood pressure concerns, not feeling the baby move, heavy bleeding. You would not believe I log onto the portal and I see, these things that require an urgent response. Oh, my blood pressure is through the roof. What do I do? Send. And then you're waiting 48 hours for a response. That's not good. That's a phone call. Please call for matters like that. If you're not feeling your baby move, that cannot wait 48 hours or 2 business days for a response. Also, please don't send blitz messages. So remember, 2 business days. So if you send a message and you don't hear back from me in a couple of hours, please don't send the same message to another person and then a couple of hours to another person and then a couple of hours to another person. We had someone very upset that she had 4 antibiotic prescriptions at her pharmacy and wanted to know why we kept calling them in. And it was because she messaged 4 different people asking for antibiotics. So if one person is working on something, it is not an efficient use of our time to have everybody in the office trying to address the one problem. The other thing is that if you cut and paste that message to multiple people, the portal will think that you're a bot trying to spam us and you'll get your whole account deleted, and that is really hard to reinstate throughout pregnancy. Also, please don't try to have a whole appointment via the patient portal. So sending us copies of records, people will sometimes send me 50 or 60 pages and ask me what I think about it. That's a visit. So text yourself questions or schedule an appointment, and we're happy to go over things that are lengthier. Remember, the portal is for quick things because we've seen patients for 8 hours during the day, probably charted for another 2 hours, and we want to spend a little time with our families before we go to sleep. So the portal is really what we're doing in our spare time, our free time, to try to make things more convenient for you. So please help us help you help ourselves. Other things that we release over the patient portal are ultrasounds. Urgent findings are discussed the same day. So if there is something that is urgently abnormal about the ultrasound, we will not let you leave the building until we have made a plan for it and figured out what the next step is for what was found on the ultrasound. Otherwise, the providers have to wait until the ultrasound report downloads from the machine, uploads into our electronic medical record system, gets sorted and divided into which provider is going to review it, and then we take a look at it. So please also give us 2 business days to review and respond to it. Sometimes you'll be in there and watch, Kathleen or Taylor typing on their machine, and you think, oh my gosh, what's wrong with my baby? And people go out to their car and send me a message. What does my report say? And my message is usually, I don't know yet because I don't have the report, but I can tell you it was not urgently abnormal because we let you walk out of the building. And remember, that is the take-home message. We won't let you leave if we know that there is something urgently abnormal. There are some things that are abnormal, but it's not urgent. It doesn't require a plan on that day. Like if the placenta is not in the right place, there's nothing we can do about it on that day, and there's nothing you can do about it, but we'll just tell you about it once we see the ultrasound, and we'll send it out to the patient portal. Now, if you know you're the type of person who cannot wait 2 business days for it, please try to make an appointment with one of the providers on the same day. They can talk to you about the preliminary findings on that day. Otherwise, 2 business days. Who else has a patient portal? Quest. Very annoying because they will sometimes send the results to you before they send them to us. Sometimes they don't send them to us at all. And then you'll get the report and it has all this red on it and it freaks you out. But remember that red doesn't necessarily mean abnormal. The reference ranges that they're using for Quest at baseline are for non-pregnant people. Pregnancy reference ranges are different. There are some things that are physiologic changes of pregnancy that change what your values are, and it's still normal. So please give us a chance to receive the labs from Quest, review them, and release them to you. Now, if you've been sitting on those results for more than a week and you haven't heard anything from us, then please let us know because there is a possibility that we have not received them from Quest yet, and we can always request them and get them. Also, please make sure that you're using the same name at the lab that you are using at our office because things are sorted into your chart based on what your name is here. So if you're Jane Smith at Quest and Jane Doe in the office, we won't receive your labs into your chart. They'll just be sitting in an undefined hold bucket someplace because we don't have you as the same name as the lab. So please try to be the same person in all places. All right, any questions on communicating with us or lab stuff? Ultrasound results. Okay, cool. Let's move on. All right, next thing, what to expect at your prenatal visit. So first thing, pregnancy brain, it's real, man. You're going to forget everything. There's something about walking through the doors of our building that it's pregnancy-induced amnesia. So please start a text thread with yourself on your cell phones because you always have your phones with you. Text yourself questions that you know you need to ask at your next visit. Wear loose, comfortable clothing so that we can access your belly. It is cold. It's getting really chilly. So a shirt that you can lift, shorts that you can, I don't think we're really doing overalls very much anymore, but really I think those are the winter clothes that give us problems are usually overalls because you have to come out of everything to get to the belly. But we want to be able to listen to baby's heartbeat at every visit. So please, something so we can access your belly. Please arrive a minimum of 5 minutes before your scheduled appointment time so you'll have enough time to check in. And we know you're pregnant, you've been driving, you've been drinking your water, and you have to go to the bathroom. Not everyone needs to leave a urine sample. ACOG says we no longer need to do that for everyone. Only if we're following your urine for if you have blood pressure issues, looking for protein, blood sugar issues, looking for sugar in your urine, or if you recently were treated for a urinary tract infection and we need a test of cure. So you only need to leave a urine sample if indicated, and you'll know if you're one of those people. If you are 10 minutes late, We'll still obviously have time to check on you and your baby, blood pressure, heartbeat of the baby, and all those good things, go over some labs, but it leaves little time for your questions. If you're 20 minutes late, you've missed the entire appointment slot. We may be able to work you later on in the day. Remember, I said we do have a limited number of same day appointments. People deliver, that frees up appointment slots. If that time that we have available doesn't work, the girls up front are actually really good watching, the schedule. They'll say, oh, she's, stuck in traffic. She's going to miss this 2:40 slot with Jane, but I see Dawn has one at 3:20. By the time you walk in, if you've already missed one appointment, they will very likely already have one available to offer to you to try to work you in later in the day. If that time doesn't work for you, we can definitely reschedule to a time that's mutually beneficial for both parties. All right, diagnostic ultrasound visit. So the other question I get is, when am I going to get an ultrasound? Good question. So remember, these are separate appointments from prenatal visits. We are not doing ultrasounds at your routine prenatal visits. So the way to tell if you have one, if you have an ultrasound scheduled, is to see whether or not you have more than one appointment time and whether a provider's name is associated with your visit. So when you log onto your portal, this is Tina Test. She's our test patient, not a real person. And she clicks on her appointment tab. Tina notices that she has 2 appointments scheduled on the same day. One of her appointments is scheduled with ultrasound. Ultrasound is not a provider's name, so Tina has an ultrasound scheduled. The other appointment is with Dr. Yeckel. Dr. Yeckel is a provider's name. So Tina has an ultrasound scheduled. She can tell her family, hey, come hang out with me at 9:20 and see this ultrasound, look at this baby. And if you want to hang around for my regular OB visit at 10 o'clock, you can stay and talk with Dr. Yeckel. If you only see Dr. Yeckel on there, you are not scheduled for an ultrasound. If you think you're supposed to be, please let the front desk staff know. As you're checking out, typically when you finish up your appointments with one of us, we'll say, hey, you're due for an ultrasound. You need to make sure you schedule that at the front desk. We do send messages to front desk to let them know what should be scheduled next. But if you're like, sometimes y'all are fast, y'all get to that front desk before our messages do. So if you know you're supposed to be scheduling one, please be sure you're getting more than one appointment slot scheduled when you're going up to the front desk. Remember, the results will be sent to the portal within 2 business days unless, that's right, there's something urgently abnormal. And in that case, our sonographers are very good. They've been doing high-risk ultrasounds combined between the 2 of them for over 40 years. And they can tell you, hey, this isn't something that should leave. They'll come get one of us. We'll interrupt our patient day and come and talk to you and make a plan for that on the same day. The next question I have is, how many ultrasounds will we have? That's a question I'm going to answer in just a moment. So again, as I was saying, let the front desk know when you need a prenatal visit and a diagnostic ultrasound visit when that is due. If the number of ultrasounds that we think you should have is not the number that you think you should have, there are boutique ultrasounds. So for us, remember I called them diagnostic ultrasounds. So these are for a medical reason. If you just want to look because you think your baby's cute, we think your baby's cute too, but your insurance won't pay for you to just think your baby's cute. You can go to some of these places. Stork's View Baby's Close-Up Sneak Peek are here for informational purposes only, not endorsing any one over the other, just trying to tell you there are a couple in different areas of town. I know there's one in St. Augustine too, but I can't think of their name. But anyway, they do these cute little things. They put the baby's heartbeat in a stuffed animal. They give you all these 3D pictures, and you can have a USB to take home and all of that. Ours are diagnostic, and so we usually do them right about the middle of your second trimester, and then if you go past your due date. So the poll question, and also the answer to the question that I just had up there, is, when should I expect routine ultrasounds? And as you're answering that poll question, I'm actually not going to talk a lot because I'm thirsty. I'm going to drink a little bit. All right, and the polls are closing in 3, 2, 1. Okay. That's right. As I just said, in the middle of your second trimester, which is around 20 weeks, that's when you have your anatomy ultrasound. We're not doing ultrasounds at every visit. We're listening to baby's heartbeat, but with the Doppler. So, excuse me, your routine ultrasounds are at 20, and if you go past your due date, which is 40 weeks. That's routine. Now, if there's something that's not routine, say, for example, we're not able to see everything we need to see on baby, then you'll have another ultrasound to follow up and be sure. If you develop some complication of pregnancy, like low-lying placenta, high blood pressure, diabetes, you'll have other ultrasounds. If you have twins, you'll have more than that. But none of those things are routine. So routine ultrasounds, 20 weeks, and if you go past 40 weeks. All right. And see, I answered that question right away. All right. For some reason, we are looking at delicious food and not our website. And there's the website. And we'll go back to the delicious food later on. This is fullcirclejacks.com. So, everybody, please remember this is the website where all of these amazing resources are going to be. The next couple of things that we go over. The question I have up here, if the baby cooperates, can the gender be confirmed at my 20-week ultrasound? If the baby cooperates, you can start talking to your baby right now. Yes. We'll start with the provider tab. So one of these lovely ladies will get the opportunity to welcome your little one or little ones into the world. There's me. There's my buddy, Dr. Mero. There's my other buddy, Dr. Yeckel, and our buddy, Dr. Mooney. Dr. Mooney is our newest addition to the practice from the physician side, and we're very excited to have her as a full-time doc. And we have our midwives, midwife Lauren, midwife Krista. We have midwife Cindy. There's midwife Dawn. There's midwife Missy and midwife Jane. And you can click on any one of them and learn a little bit more about us. But I think probably the most important thing to know is that we are all self-professed birth geeks. This is our favorite thing to do. Absolutely. Is help people complete their families. All right. Over here under patient information, you will see the obstetrics tab. And the obstetrics tab is where you'll find lots of good stuff. You'll know you're in the right place because you'll see all the bellies that lead up to the baby there at the end. And then you'll see all these colorful tabs down here, starting with our delivery stats. So many of you are with us because of our delivery stats. A lot of first-time moms who are trying to avoid an unnecessary C-section, and some moms who are trying to avoid an unnecessary repeat C-section. Welcome. So we'll click on a couple of these tabs to just go through some things with them, but just remember our stats are out there. We're very transparent about our numbers, and actually they'll be coming up in the next couple of months. If you follow us on our socials, we'll be telling you what our numbers were for 2023. All right, we'll start with the prenatal care timeline because this will tell you what to expect at each visit. I get messages sometimes people saying, what exactly is going to happen at my next visit? And I send them this link. Because everyone on this line has already had their first visit from 8 to 10 weeks is usually when we like to do confirmations. After that visit, you spoke with Renee and talked about how your insurance works here. And you registered for this webinar and got information about our virtual history visit. At the history visit, we order your standard prenatal labs. We are, again, also very transparent about what should be ordered when. So this is the ACOG routine panel: blood type, blood count, some serologies, a urine culture. If you have some other medical concerns, which is why I do this at the history visit, I may order thyroid, I may order A1C, just a couple of other things based on what your history was. If you had preeclampsia in a previous pregnancy, I may check your liver and kidney function too. So your dating ultrasound was at that time, and we should have verified what your estimated due date was. And your homework is going to be after your history visit to try to get that blood work done as close to before your next appointment as possible. Some of you, after your history visit, have opted in for genetic screening, which is optional. So you may have decided to do the non-invasive prenatal test or the nuchal translucency ultrasound. At this point in pregnancy, we are seeing you every 4 weeks. So approximately 4 weeks after your confirmation visit, you should be back in for a physical exam. So a physical exam is just like it sounds: your heart, your lungs, breast exam, pelvic exam, all that good stuff. If you have had a PAP within the last year, you don't need another PAP. If you're due for one, you're welcome to get one at that time. It's not mandatory that you get a PAP at that time. That's not part of the prenatal panel. Cervical cultures, though, are part of the panel, and that completes the original prenatal ACOG panel. If you need to see the high-risk doctors, this is when I will send that referral as well. As MFM, usually the maternal fetal medicine or high-risk docs usually see patients right around 12 weeks for the first time. Then about 4 weeks later, you're back in the office for your second trimester visit where we do a little belly check, talk about second trimester changes like brown ligament pain and feeling the baby move for the first time, which is kind of cool. Most of you will be pregnant between October and March. And so anytime during this time, if you are so inclined, you're welcome to get the flu vaccine because that is safe and actually recommended by the CDC in pregnancy. We do not offer it here. You'll go to a Minute Clinic or your primary care doc for that. Then around 20 weeks is that ultrasound that we discussed, your anatomy survey. You'll also see in the middle column the mental health screen. So we do screen using the EPDS and GAD-7 as mental health tools to give us baselines. So if we're asking you to screen, it's not because we're singling you out because we saw something, it's because you're a whole person. And pregnancy is a roller coaster of emotions and anxiety, and sometimes can have some depressive features. And we want to make sure we're picking up on that and treating it and getting ahead of it. You'll be meeting with a midwife around this time too, because this is about 4 weeks later, and talk about childbirth education and or breastfeeding classes. And we'll give you some more information on that in just a moment here on the webinar. Then about 4 weeks later, we're looking at the glucose challenge test, which I will talk about in a little bit because I know that's a hot button topic. My moms who have the blood type that has the negative on it. So if you're Rh negative, then that is definitely something that we're going to be addressing, making sure that you have the proper medication in house to give to you around 28 to 30 weeks. At this point also, we're going to have you doing your pre-admission forms or your which is online at HCA Florida. So you'll be getting the information to create your patient account at HCA. You can schedule your hospital tour around this time as well. And if you plan to work with a doula, you definitely want to have her secured by the end of your second trimester. Then it starts to ramp up. We start to see you every 2 weeks. Your tetanus booster you can get around the beginning of your third trimester as well. My first time moms, you want to figure out who your pediatrician is going to be. Most of them have meet and greets. We also have information like we have brochures and pamphlets around the office too. You want to start looking for who matches your philosophy. In the middle there, you'll see the option to repeat or decline your standard prenatal labs. This is from Duval County Health Department, a recommendation for certain high-risk populations to repeat certain labs. If you feel you are low risk and you would like to decline or repeat, we have a standard form you can just sign that lets everyone know that we did offer it to you because that is the responsibility for us. Is just to offer it to you. And then if you decline it, then you don't need to have that done, but you may have other labs that need to be done in third trimester. At 32 weeks, moms who have some other issues going on with pregnancy, like blood pressure or blood sugars, will start doing some testing. Those who are planning to have a belly birth will start getting which is our word for a cesarean delivery. We'll get your date set up when you're around 33 weeks or so, and we continue the every 2 week visits until you're 36 weeks. Then we do a group beta strep swab, which is not an STD, but we'll talk about why that's important then. And if you've already declined repeating your STD screen, that also declines repeating your cervical cultures. After this visit, we start seeing you weekly and you're full term. Yay. So being full term means bring in that birth plan so we can talk about it and just set some expectations. You'll start your natural cervical ripening methods. And then at 39 weeks or by 39 weeks, the majority of our belly birth moms will get off the train. And those who are waiting for baby to give the signal for labor will do the most difficult part of that and be patient. Wait for the baby to say it's my birthday. We want everyone delivered by 42 weeks. So for my first time moms, 41 weeks and 5 days is typically when we would like to schedule inductions, and 41 weeks and 6 days for my veteran moms. And the question I have here is, what's the difference between a midwife and a doula? We're going to put a pin in that because I'm definitely going to answer that later on. All right. So everybody out by 42 weeks is basically the take home here. So remember that this is out here so you'll know what to expect at your next visit. All right, pregnancy safe medication. So if you have a headache, what are you more likely to do? Are you more likely to meditate, to medicate, take a Tylenol, or to evacuate and go to the emergency room? And while you do that, I'm still so thirsty today. I have a little more water. And the polls are closed in 3, 2, 1. Boom. All right, we have more meditators than medicators on the line here today. I'm probably more of a medicator, but zero judgment. Um, I talked to some of you already, and you said, "Oh, I'm getting these horrible headaches since I've been pregnant." Hormonal headaches are a thing. So are hormonal everything else. And this is a list of common discomforts in pregnancy, along with some relief measures and medications that it is safe for you to take during pregnancy. So these are in alphabetical order, starting with backache, and some of the things that we recommend. So many of us, when we do get messages that say, "Oh, I'm congested, is there anything I can do about it?" You're going to get a link to this page right here. And they're going to ask, "Have you tried everything on this page yet?" And if so, then we move on to whether or not you need to come in or have, prescriptions or that sort of thing. But the first things we're going to want you to do is exhaust everything that's on this list. So as we roll down, you can see we are in cough and cold season. So medications for that, congestion, sore throat, all that good stuff is on here as well. And along with some things that we don't recommend, so pseudoephedrine, Pepto-Bismol, Lomotil, and even it continues on to the second page where you'll see some other things like nausea, vomiting, which is probably more what this crew is dealing with right now. And so the question that we had earlier was about vitamin B6. I don't have a specific brand. Nature's Way is always an easy one to find in any grocery store or drugstore, but 50 milligrams every 6 hours is what we recommend for the dose. See, I didn't forget your question and I did answer it. So remember that this is out here because very likely you'll have other questions about other medications that it is or is not okay for you to take during pregnancy, and these are our initial answers. All right, so just remember this is out here. You can download it to your phone. You can print it out, stick it on the fridge because you'll always need it at 3 in the morning. I promise. It's always when that happens, when you can't take it anymore. The next tab is a gestational diabetes screen. We're not going to click on that one, but please remember it's out there because I am going to refer back to it. And we will and we'll talk about it in more detail. Next question I have, is it safe to continue to take the Unison B6 through the entire pregnancy? Yes, it is. Hopefully you won't need it the whole time, but yes, it's fine. It's just a vitamin. All right. Weight gain during pregnancy. So I've also gotten, "Oh my gosh, I've gained so much weight already. What do I do?" Or, "I haven't gained any weight and I'm so concerned." These are your recommended pregnancy weight gains for your entire pregnancy. They are based on what your starting weight was for pregnancy. So there's a link on here that you can just click on and you can put in your height and weight pre-pregnancy. And based on what your body mass index was, it tells you how much you need to gain to support a healthy pregnancy. If you're having twins, you can add a 10 onto the highest number in those middle columns there. The next question is, what's the process of inducing labor? Hold on, we're going to get to that. All right, but for weight gain in pregnancy, you will also see in that third column that was on there that those numbers are for second and third trimester. So first trimester, if you're not keeping things down very well, if food just doesn't sound good, you have food aversions and all of that stuff, just hang on, it's going to come. Your appetite will definitely return to you, and when it does, eat responsibly and just make sure that your weight gain is appropriate. If you're staying active and you're making healthy choices with your food, your body will do what it needs to support a healthy pregnancy. So don't be obsessive about this, but definitely keep an eye on it because excessive weight gain in pregnancy is a risk factor for C-sections. And so what we want is for baby to be able to settle into the pelvis appropriately. And so we give baby the best chance of doing that by us staying active and making sure that we are only giving baby what he or she needs. Birth preferences. So we're going to click on this one and take a look at birth preferences. So the question we just had was, how do we induce labor? See, I told you I was going to answer it. Induction scenarios. How long do you want to wait? So remember we talked about when we would induce to have everybody out by 42 weeks. And there are some things on here with regard to things that you can do to get things started. Having us strip your membranes or doing natural cervical ripening methods, which we're going to talk about in a moment as well. We also talk about different methods such as catheter, Pitocin, Cytotec, membrane rupture, those sort of things as well. But those are specific to the person. So telling you all the different ways that there are to induce labor may not actually apply to you. But this is a matter of preference and opinion. So if everything is going the way that we expect and want it to go, everything on here is fair game for most of you. So going back to the first page of this, just to kind of highlight the fact that we are not starving you and strapping you to the bed, movement is encouraged. So as long as you are safe and baby is safe, your blood pressure is fine, you're not bleeding, and baby's heartbeat looks good, we want you to be an active participant in labor. We do have wireless monitors. We want you to move around. If you don't want to wear the hospital gown, we don't care about that. You can buy a gown off of Etsy with your baby's name on it. It doesn't matter. In terms of pain relief, it is a hospital. Obviously, we have epidurals and we have IV pain medicine, but we also have hydrotherapy, meaning we have tubs for those who meet criteria and are able to labor. We also have nitrous oxide for analgesia. You'll see that laboring in any position is fine, pushing in any position is okay, and delivering in any position. Our standard is usually perineal massage, warm compresses to try to prevent tearing. Episiotomies, I've probably cut 5 in the last 20 plus years. And they're usually for like distress of the baby. Like baby needs to come out right now. We don't cut episiotomies standardly. So you can just see, like, it may look overwhelming. There's 21 boxes on here. Not all 21 are going to apply to you because, one's about twins, one's about belly birth. There's one about circumcisions. Probably half of you are having girls. So just take it one box per week and take a look and see what is salient to you, what makes the most sense to you, what's most important to you. Bring it in, talk to the midwives about it. And the midwives will have a conversation with you all about, just kind of helping you figure out your way and what's most important in your birth experience. So just remember, this is out here. When you're full term, you're going to bring that in and we're going to talk about birth preferences. Cervical ripening techniques. So these are things that you can do at home. So this is, I guess, an extension of that question, how is labor induced? None of these things will actually put you into labor, but they tend to soften your cervix as well as tone the uterine muscles so that when baby gives the signal that it's time for labor, this kind of makes it more efficient. So at 20 weeks, you can start your raspberry leaf tea, build up to 3 cups a day. After 36 weeks, though, is when it really kicks off, when you can start seeing your acupuncturist. You can do evening primrose, breast pump. You can also use clary sage and evening primrose. Like all the stuff is out here. So just know that these things, and for the person who was thinking, what is membrane stripping? Because I did say that earlier. Here's the definition out here as well. So remember, this is out here as well. You won't need it today, but you will want to know it later on. The next question is, how would you recommend learning more about the preferences, pros and cons of washing the baby? So because there's nothing dangerous about one thing or the other, these are things that you can consult with your doula, or you can even talk to the midwife, because again, those are personal preferences versus medical interventions or indications for going one way or the other. All right, the next box I have here is for first-time moms in trial of labor. Do I have any moms who are going for a VBAC here? Is there anyone? So VBAC is a vaginal birth after cesarean. So I know my first-time moms are not doing it, but is there anybody here who had a C-section who's planning or belly birth and planning this time to not do that? Cool. And there are only 2 options here. Either you're gonna rock it or it doesn't apply to you. All right, very good. So these next couple of things we're going to go through, this is for you first-time mamas. And this is also for you VBAC mamas, because you are both essentially doing the same thing, trying to avoid an unnecessary C-section. So the most common reason that I do C-sections, the most common reason really all of us do C-sections, is not, oh, the baby was too big, or oh, the baby was in distress. It is the baby had a crooked head. The baby was in there sunny side up, or the head was down, but just crooked kind of off to the side and wouldn't come through the pelvis. So for my VBAC mom specifically, fear release mediator, if you had a previous birth experience that is weighing heavily on your brain, on your heart, Please let that go. Do not bring that baggage into this birth. Now, for everybody else, everything else. Webster certified chiropractors make sure that baby rotates appropriately into the right position in the pelvis. Do your exercises, do your squats, we're going to talk about in a moment. Only gaining the recommended amount of weight during pregnancy, getting an experienced doula, and we'll talk about doulas in a moment. Spinning babies to do exercises for baby's position, avoiding non-medical induction before 41 weeks. This is for my first-time mamas. Everybody gets tired and wants to not be pregnant anymore. And then I see those mamas come back for their VBACs and say, man, I wish I had just waited one more week and given my body another chance. So that leads us to trust your body and your providers. We're not telling you things just because we want to torture you and make you stay pregnant forever. We want your baby to give the signal to say that we're in the right position and in the right headspace in order to be able to deliver vaginally and avoid the C-section if at all possible. And then if you're having a little guy and you want to have him circumcised, we do that in the office up to 10 days of life. So when you deliver, we will let Naisha know. She'll send you a message with his first little appointment time, and you can bring him in and we'll take good care of your little guy. All right, so remember, all that information is out here at fullcirclejax.com. We're going to head back over to the presentation now and rejoin that mocha monstrosity, salted caramel mocha monstrosity that we saw before. And so when I hear, Dr. Adams, why am I gaining so much weight? In the morning, all I have is coffee. And then I thought, no, was it coffee or was it salted caramel mocha coffee? Because you can see there's a big difference in those numbers at the bottom. Sure are. Did you know pregnancy only requires an additional 300 calories per day? That is not as much as you would think. It takes 10 kilocalories to maintain a pound, and your goal weight gain for pregnancy is based on your starting body mass index. So, for example, if you are starting this pregnancy at 170 pounds, that takes 1,700 calories to maintain. If your goal weight gain is 25 pounds for the pregnancy, that's an additional 250 calories for a total of 1950. Divide that between breakfast, lunch, and dinner, and each meal should be around 650 calories. Do not drink your calories on top of that. So if you eat something that is 650 calories, please do not wash it down with 570 calories of drink, because your baby doesn't know the difference. Baby's going to take the first 300 calories and the rest just kind of go to you. Happy Mother's Day. All right, so always remember these nutrition facts, like just flipping things over very quickly will help you make really good decisions in the grocery store, especially with regard in the second and third trimester to sodium and swelling, because that is when these rings start to get tight and you send messages, what's happening, Dr. Adams? My fingers are blue. How much salt did you have yesterday? Especially around these holidays. Those ankles are going to get big, ladies. So please watch the salt intake. And then you can just kind of use this. Remember, again, this is out here percentage of where your calories should be coming from, carbohydrates versus fats versus proteins. All right, so what kinds of foods should you be eating? Fruits and veggies, whole grains, cereal, nuts. You're not going to give your baby allergies or sensitivities to nuts or dairy, so go ahead and enjoy those. For my coffee drinkers, you want to keep your caffeine at less than 200 milligrams per day, which is still a lot of caffeine. And remember, caffeine is a diuretic, so use the 3-to-1 rule. You want to drink 3 times as much water as caffeinated beverage that you are having if you're drinking coffee. Also, in third trimester, some of those caffeinated beverages can cause some irregular heartbeats in baby, and so we will ask you to kind of drop that back even more. Herbal teas are fine. Our favorites for pregnancy are raspberry leaf, ginger, lemon, and peppermint. For my protein, my bodybuilders, you want to keep your protein around 70 grams a day. Anything under that, you get these scrawny little underweight babies, and anything over that, like if you're excessively, there are some pregnancy diets that tell you to have 120 grams of protein a day. Please don't do that. You're going to grow a 10-pound baby, and it really won't matter if that baby's head is in the right position, unless everybody in your family is 10 pounds and that's just how you're built. But most of us are not built that way. So please, 70 grams of protein is plenty to sustain a healthy baby. Deli meat, yes, you can, as long as you microwave it for 30 seconds. It does not have to be piping hot when you get it out. Please don't burn your mouth, but be sure you leave it in there for the 30 seconds to get rid of that bacteria. Your soft cheeses, as long as they're made with pasteurized milk, like if you're buying it from Publix or Trader Joe's, just flip it over. You can see pasteurized milk on there and you'll be solid. If you're at a restaurant and you can't verify what kind of milk it was made with, just skip the soft cheese for the evening. Canned tuna, you may have 3 of the 4 ounce cans per week, which I think it's plenty of tuna, but maybe you want more fish than that. If you're pescatarian, this is for you. If there are other fish that you have questions about, the FDA has a very nice document regarding what fish you should be eating a lot of because they're high in DHA, which remember I've been telling you guys about prenatal vitamins. You want to have one with 200 milligrams of DHA. Some fish has it also. Fish that you want to eat sparingly and some that you want to avoid altogether because of methyl mercuries. This document does change throughout the year, so just remember this is where the website is so that you can take a look. Things you want to avoid though, undercooked fish, undercooked meats. So if you're a foodie like me and you love your medium rare steaks, I'm sorry, you're going to have to ruin your steak for the next several months. And eat it well done. My kombucha drinkers, my kimchi eaters, those are fermented beverage and foods. Your body treats those fermented things as alcohol. Also avoid alcohol because we just don't know what the safe amount is. And so we can't safely recommend any amount. Sodium, again, keeping it under 1,500 milligrams per day. And when you start turning these foods over and finding how much sodium is in things, you will be appalled and surprised at how little 1,500 milligrams actually is. Any questions about food before we move into exercise? Okay. I feel like y'all have kind of gotten the thing that every time you ask a question, I say I'm going to answer it later. But please feel free to keep asking, though, so you don't forget them. And I'll tell you if I'm going to answer it later. All right, exercise in pregnancy. It is okay to continue your pre-pregnancy activity unless your pre-pregnancy activity was doing nothing. Then we want you to start doing something. Second trimester is when you're going to feel like doing something, though, because first trimester, just everybody's sick and everybody's tired. You'll get some physiologic changes. You're going to increase your blood volume by 50%. You'll have more oxygen, tension, and saturation to accommodate more aerobic activity. So just listen to your body. If you're not the Olympia athlete that you were before, don't beat yourself up. It will come back and you'll be amazing again. Those of you who were not doing anything before, no judgment, but just a little judgment. But it's okay to start a new regimen. Remember, again, sedentary lifestyle leads to malpositioned babies, leads to meeting me in the operating room. I don't want to meet you there. I don't. Your resting heart rate, for those of you with these cute little Fitbit watches that probably add to your anxiety, your resting heart rate will raise 10 to 20 beats per minute. So when you're just sitting there not doing anything, you'll notice that your heart rate is higher than it normally was. That is a normal physiologic change of pregnancy. It is not anything to worry about. If you are not getting dizzy and passing out, it's okay. For those of you who have been doing walking for your exercise, walking is exercise if your heart rate is in the aerobic zone, which is 70% of your maximum heart rate. Your max heart rate is 220 minus your age. So if you're 30 years old, you start with 220 and you subtract 30 to get 190, which means at 30, you should not be exercising with your heart rate above 190 for sustained periods of time. 70% of 190, though, is 133. So you want to be exercising with your heart rate between 133 and 190 for 30 minutes, 3 times a week. If when you are walking, your little Fitbit watch says that that's where your heart rate is, then that is exercise. If when you are walking, your heart rate is normal, that's transportation, and that's not exercise. It's okay to get from point A to point B, but let's not pass that off as exercise. Next question I have is sauerkraut okay to eat while pregnant in small amounts? Yes, it is. Cardio. If you like exercising and doing cardio, treadmill, yes, that's fine. Elliptical, yes. Running, of course. Swimming, sure. The heated pool. It's very cold outside now. Indoor bikes. If you have a Peloton, my leaderboard name is Off My Meds 8. You follow me, I will follow back. We'll put some blue dots on the board together. Other exercises, weightlifting. If you were weightlifting prior to pregnancy, it's okay to continue your pre-pregnancy level. Don't add resistance or weight. Your baby and your body will do that. Squats are my favorite. If you can build up to 50 squats a day, so if you're not already squatting, at 20 weeks, I want you to start doing 5 a day. 21 weeks, 10 a day. 22 weeks, 15 a day. Build up to 50. They don't have to be 50 all at once. You can do 25 in the morning, 25 in the evening. That helps to get that pelvis open, let that baby settle into the right place. You can do more than that. If you're already, an experienced squatter, do as many as you possibly can. That's fine. That will only help when it comes to labor and delivery. Other exercises, Pilates and yoga are my favorites. Just think anything that helps to get those muscles stretched out, long, and lean, get that pelvis open. And any experienced instructor will be able to help you with what the appropriate pregnancy modifications are. Exercises you want to stay away from. High intensity intervals after first trimester. It's not the interval, it's the high intensity. You can still do those exercises, but you want to do the low impact version of them. Just no sudden jerking movements that can shear the placenta off of the side of the uterine wall. Anything that has you lying flat on your back for extended periods of time, like excessive ab work. You can do side lying abs, you can do standing abs, just not lying on your back for those 20, 30-minute sessions. Hot yoga, unless you are a hot yoga instructor, you'll get dizzy and you'll fall and you might fall on your belly. Don't do that. Scuba, because of the changes in barometric pressure and decreased oxygen to the baby. Same thing about high altitude hiking. You can visit family in Colorado, but just don't go hiking with them. In contact sports, please do not take up kickboxing now during pregnancy. Not a good time. And outdoor biking, after 16 weeks is when your center of gravity starts to change. So there's an asterisk there. You can outdoor bike. Just know when you turn the corners, like you might tip over. So just be mindful of that as your center of gravity does start to change. And the next question is, when do you need to stop sleeping on stomach and back? And that is actually coming up in our frequently asked questions. So um, here's my next frequently asked question. Can you prevent gestational diabetes with diet and exercise? And my veteran mommies know how I feel about all this. So we're going to close the polls as soon as I take another drink here. Closing in 3, 2, 1. All right. Oh my gosh, no. All right, so the answer is false because the key word here is prevent. Can you keep yourself from getting gestational diabetes if you just eat well and exercise? No, you cannot. That is false. So my 10% of people said that it was false. You guys are the real MVPs today. All right, so the reason why we screen everybody for gestational diabetes is because everybody has a placenta. That's your number one risk factor for gestational diabetes. Your placenta gives off hormones that tell your insulin it doesn't need to do its job. And the job of insulin is to clear your body of excess glucose. So you have this placenta saying, insulin, take the day off. And so then you get all this extra glucose, all this extra blood sugar circulating, and that is literally the definition of gestational diabetes. It happens in people who are rail thin. It happens in people who have no family history. It happens in people who never ever eat any sugar at all because they have a placenta. That's literally the only reason. So if you can figure out how to do this pregnancy with no placenta, then I won't screen you for gestational diabetes. But I think everybody's getting screened. And those of you who have twins, you have 2 placentas. So you're definitely getting screened. So my moms who say, but I don't eat any sugar at all, you eat good carbohydrates. And so we recommend that you don't avoid those prior to the test because if you eat minimum amounts of sugar anyway, you're more likely actually to develop an insulin resistance because your insulin usually isn't called into action very much. So eat your fruits, eat your whole grains, eat your regular good carbs leading up to the test. If it is the actual drink that bothers you, we have some options for that. So one that is available for purchase at the office is the Simply Pure drink. It is soy-free, it is dye-free, it is gluten-free, it is BVO-free, it is kosher, it is vegan, it is offensive to almost no one. There are some additional patient-driven options. Remember on the website, there was that box that said, well, we're not going to click on it, but just remember that this is there, so I'm going to refer to it later. This is me referring to it now, which is later. On there, we have the Fresh Test, we have Glucoganics, and there are links to both of those websites on there, as well as glucose tabs that you can get off of Amazon. So there are multiple different options so that you do not have to drink what is at Quest. However, if you plan to If you plan to take one of these alternatives, please mention it to your provider when she's ordering it because you cannot go to Quest. They do not take outside drinks. Also, we need to write on your requisition that patient will be bringing her outside drink and will be giving you instructions in terms of things like don't drink it before you get to the lab, don't open it before you get to the lab, all of those sorts of things. So just let us know what you plan to take in terms of your glucose screen. All right, other preparing for birthings, childbirth education classes. So you saw the ones that are available at HCA Florida. These are more method classes. So those of you who are going for unmedicated births are usually more inclined to do method classes as well. So hand to hold, birth your way. So these are things like hypnobirthing. There's Bradley method. There's hypnobabies. There's Lamaze. Those are all out there. For the partners, supporting her is also a course that is available because dads and significant others ask me all the time, what do I say? What do I do? As little as possible for what to say, as much as possible for what to do. But also check out the supporting her course because it helps you to safely navigate not getting kicked in the head during labor. Preparing for birth, breastfeeding classes, as we mentioned, they are at HCA. We can also connect you with La Leche League. And then there's CPR for parents. Every new parent should know CPR. So these are links to Red Cross for taking a class. And if you're like, oh, I already know CPR for adults, it's different for infants. And it's not just doing it with one finger. Like there are different intervals and things. So, and a nice refresher is never harmful. Jack's Mobile CPR is another business that will actually come to your house and do mobile private classes. If you're seeing a chiropractor, make sure that he or she is Webster certified, which is a special pregnancy certification, because pregnancy does physiologically change the alignment of your spine. And someone who's Webster certified knows how to make the adjustments to adjust you appropriately. All right, so my next question, how many of you are planning on working with a doula? And I know there's at least one person out there who is asking me what is the difference between a doula and a midwife. And spoiler alert, the answer to your question is coming up very shortly. And the polls are closing in 3, 2, 1, boom. All right, very good. Many of you are already saying that you're planning to work with a doula, and a lot of you are just unsure of what it is. Okay, well, we're going to talk about that right now. Okay, more preparing for birth. So doulas. And you're saying, what? This seems like quite an extensive team. I have a physician, I have a midwife, and you're saying I need a doula and I'll have a labor nurse. Who are all these people? So doulas are there for physical support and emotional support. Doulas are not medical. They're not part of your medical team. They're part of your birth team, but not part of your medical team. So certified nurse midwives begin with their bachelor's of science in nurses. They are RN, BSNs. Really all of our midwives were labor and delivery nurses at one time. And then they went back to school and got a master's. They're nurse practitioners. Then they got an additional master's in midwifery, which is care of the physiologically laboring mom and normal newborn. And so they are part of your medical team. So they function as physician extenders, as nurse practitioners in some cases. And then they function as midwives, which are independent creatures who are just masters of getting babies out of you, who are trying not to come out of you in strange positions and things like that. And so the midwives are the ones who are collaborating with the physicians on any medical aspects of your care. So doulas are there for, again, emotional support, for discussion of your birth preferences, for advocating for your birth plan in the hospital where what you're seeking is medically safe, and figuring out how to bridge gaps in communication between you and your birth team. Doulas bring us patients all the time because they like the fact that they don't have to spend their time fighting with us. They know that we are typically going for the same thing that the patient is looking for as well. The best doulas are the ones who will, meet with you ahead of time, go through your birth plan with you to kind of set expectations about things, when to go to the hospital. They will usually come to your house when you think labor is starting, come with you to the hospital and stay with you until your baby is latched. Sometimes they're there for postpartum support as well. So we've been working with doulas for almost 10 years in the community. So definitely feel free to ask the midwives if you need recommendations for who the ones are that we've seen support our moms very well over the years. Hopefully that answered the question about the doulas, the difference between the doula and the midwife. Acupuncture. Acupuncture is when you come out of the bathrooms in the front, you'll see a line of business cards up there. Everybody there has worked with pregnant women, and we have a lot of different resources in the community for that, as well as for pregnancy massage. Breast pumps. Many of your insurances cover breast pumps. Please do not feel like you need to go out and search for your own company to supply a breast pump for you. You don't need to request a prescription from us for a breast pump. We actually have a company that makes it very easy for us. So this is our little selfish plug in here. Is sometimes the companies that you find send us 3 and 4 pages requesting information. It's just a breast pump. Like all they really need is a diagnosis. So we found a company that will actually bridge the gap. They will reach out to your insurance company, find out which ones are covered, give you the options, create the script, send it to us, and send it back. All we have to do is sign it. So around 20 weeks, so just think around your ultrasound visit, just scan the QR code that is in the exam room already, and that will set the process in motion for you to get your breast pump. We're taking that off of your plate because in the long run, selfishly, it helps us not to have to fill out pages and pages of what your favorite food was in the 4th grade to just get a breast pump. All right, postpartum care for moms who have any issues with blood pressure. You'll be back in the office sooner than your 6-week visit for us to check the blood pressure. Moms who have a belly birth, your incision check is usually around 2 weeks. And again, routine mental health screening we do postpartum as well. Postpartum doulas. Remember, if doulas are there for physical and emotional support, when do you need it more than right after you've had a baby? So there are resources available for postpartum doulas as well. The motherhood space is an amazing resource here in Jacksonville. I believe we are one of only 5 pilot cities in the country that has this awesome resource for postpartum mental health care for moms. And so, yay, Jacksonville, because that's an outstanding achievement. And Dr. Jill Garrett at Baptist Health is making that a reality. And pelvic floor therapy, which is the standard in European countries, is offered here at Full Circle. So after you deliver, our standard is at 8 weeks, you begin an 8-week physical therapy course here with a nurse who comes to our office. And if we're in network with your insurance, then so is she because it's billed under us. And just to help with some of the urinary and bowel and pelvic heaviness after having any delivery, vaginal or cesarean. The next question I have, do you get a breast pump with every pregnancy? Typically, your insurance will cover a new pump for a new baby. All right, so the first question here I have is the sleep question I had earlier. Yes, you can sleep on either side. You can sleep on your left, you can sleep on your right, and you can sleep on your back. And there's really no time that you have to stop. Like I tell you, oh, this number of weeks you have to stop sleeping on your stomach. Your baby will tell you. When you try to lie on your stomach, your baby will kick you and it will be very uncomfortable and you will automatically roll off of your stomach. There are no rules about sleeping on your back. Some people may get dizzy from compressing blood vessels sleeping on their back. If that happens, just grab one of those wedge pillows off of Amazon. You can stick it under one of your hips and you won't roll over onto your back. It's fine. You can help paint the nursery. As long as it's well ventilated, you can wear a mask and keep the windows open. You may take probiotics in pregnancy. That's fine as well. You can also dye your hair, which includes your eyebrows. You can do gel nails too. And you can travel in the car. So holidays are here. You guys are going to want to travel to your family. So up to 37 weeks, car travel for distances is fine. After that, you want to stay within 30 minutes of us, but just be sure you're getting out and stretching every couple of hours. And if you're drinking enough water, you'll definitely do that because you'll have to get up and go to the bathroom every couple of hours. Skincare, you can use your salicylic acid, your benzoyl peroxide, just nothing that has retinol in it. If you need a retinol alternative, there is bakuchiol, Bakuchiol. That is a natural vitamin A derivative that is not similar to retinol and that is not teratogenic, not harmful to baby. Flying is fine for my twins up to 32 weeks, for my singleton mamas up to 36 weeks. Just please, please, please be sure you are wearing your compression hose and doing your toe raises to exercise those calves, staying super hydrated and getting up and going to the bathroom frequently while you're on the flight. Those things are very important to prevent blood clots in your legs while you're flying. but flying is okay up to 36 weeks. No roller coasters, no water slides. That's pretty much it. I think most people here probably do early spring or something like that. So most of these things probably will not apply to you anyway. Those are my frequently asked questions that I say no to. Quick COVID-19 update, and then we're done. In terms of vaccinations, ACOG moved to strongly recommending them. Manufacturers that are okay are Moderna and Pfizer. We don't recommend Johnson & Johnson in pregnancy because of its independent risk of blood clots coupled with pregnancy's independent risk of blood clots. If you're looking to get a booster in third trimester to confer passive immunity to the baby, they've all been approved for booster injections. If you're 6 months past your Moderna or Pfizer, you can get another one. If you're 2 months past your Johnson & Johnson, you can get a Moderna and Pfizer because mixing and matching is okay. If you're also planning to get boosters for Tdap, your tetanus booster, or your flu vaccine, you don't have to time them, like space them out because they all work differently. Again, we don't administer them here in the office. You would have to go to Minute Clinic or to your primary care doctor to get any of these. If you contract COVID, there are no formal recommendations for ivermectin, azithromycin, or plaquenil, so we do not prescribe these, but we do recommend vitamin D3, zinc, vitamin C in these doses. We also recommend starting a low-dose aspirin unless you contract COVID past 36 weeks. The low-dose aspirin helps to reduce the conversion to gestational hypertension, which we see a lot more of with moms who had COVID in pregnancy. Which is also why we start monitoring baby's growth serially if you do contract COVID during pregnancy. So every 4 weeks after your diagnosis, we would want to make sure the baby's growth is not becoming restricted by COVID. So recommended course of action, it's typically supportive at home at this point. Remember, the website has information on cold meds that are okay in pregnancy. Only need to go to the hospital if you have a fever that you can't break or if you're having difficulty breathing. And I'm answering a question here. If you've had Tdap in the past 2 years, is it recommended again? So it actually is recommended with each pregnancy, personal choice if you want to reboot on that though. In terms of visitation in the hospital, who can be with you during labor, a lot of my moms who are on now had your first baby during COVID, bless you. It's so much better now. All the visitors are back, so you can still have your 4 visitors plus your certified doula. We're only having you mask in the room or in labor if you actively have COVID while you are in labor, just so you don't spread it to us, the staff. And if you do have COVID when you're in labor, we still don't separate you from your baby. You're given an isolette and an N95 mask, and then still encouraged to breastfeed, but you just don't want the respiratory droplets being passed directly to your baby. All right, so last poll question. What things can you find on the Full Circle website? And can you find the birth plans? Can you find safe medications? Can you find what to expect at each visit? Or are you all star test takers and you read everything and you know the right answer is all of the above? Fantastic. Good job. Thank you so much for catching me. I hope I answered every question because every question you had up there, I did already have in here because I promised this presentation is based on all of your questions. All right, the next questions that I see up here. Is my medical history appointment virtual? Yes, it is. In the portal, it gives the address. No, you should also have in the portal a picture from your confirmation ultrasound, which gives you instructions on how to do your virtual appointment. We can't change the update on how the portal reminds you of it, but we send you portal messages, and you'll get one also the morning of reminding you how to log in for the virtual appointment. No worries. Next question, any protein powder recommendations as a supplement or meal replacement? How do I know if I need to take any other vitamins along with my prenatal? So prenatals are typically complete. As long as you have your 400 micrograms of folate, usually I recommend more calcium anyway. They usually just don't have enough calcium. But usually those are complete. In order to be called a prenatal vitamin, they have to have certain amounts of everything. The DHA is the other thing you really want to look out for. Be sure it has 200 milligrams of DHA. The next question is, I don't think I received a blood work slip at my 8-week appointment. Do I need one? No, you will get your blood work when you do your history visit with me, because I go through your whole history and see if there are things besides the standard labs that you need. And then you receive an email from our OB coordinator with your lab slip. Other questions? Y'all are hot. I see you were holding on to those questions until the end. You got tired of me saying, I'm about to answer that. All right, seeing no other questions, I want to thank you all for taking your time today. Please remember you will receive a link to watch this later on our YouTube channel. It will be available throughout the duration of your pregnancy. And I look forward to meeting as many of you as possible in person. But I mean, quite honestly, you don't really want to see me because if you're seeing me, that means that something is wrong. You want to see the midwives because that means everything is going swimmingly with the pregnancy. So if I do not see you personally, happy holidays. And thank you again for choosing Full Circle. It means the world to us that you trust us with your family. Mwah.